Hi everyone, Kelsey from CDHF here. Hope you are all doing well and staying safe. I am here today with an exciting CDHF talk on infusion clinic visits for those with inflammatory bowel disease, or IBD for short. If you have recently been diagnosed with IBD and have been prescribed a biosimilar, or have recently switched from a biologic drug to a biosimilar, then this video is for you. As you may or may not know, most biologic and biosimilar drugs are administered by infusion, which typically means that the drug is given through an IV, where a short needle is inserted into a vein found in between the skin and muscle in the arm or the hand. In the past, you may have received a drug infusion at an infusion clinic. If you are newly diagnosed and new to this kind of treatment or drug delivery, we know you may have many questions. Similarly, if you have recently had to change infusion clinics for one reason or the other, you may also have a ton of questions about what the experience will be like at a new location. But never fear, CDHF is here. We will be answering all of your burning questions as we take you through a typical infusion at a real infusion clinic. So let's get to it.
When I have patients come into my office and they hear that they are going to have to switch to a biosimilar, usually the first concern they have is that they're going to have to give up their clinic and their nurse that they've maybe had for many years. Although they may be going to a new clinic, the Innomar and Bayshore clinics have actually been around for many years and are well-versed in patients with inflammatory bowel disease and their needs. And they have extensive experience in infusing all types of biologics.
When you first get introduced to the new program, the new coordinator, we want you as the patient to feel that any questions you have, that you can ask them freely and they will be answered. Reassuringly, what I found in BC is that most patients have found that the new infusion clinic is in similar locations, so similar convenience, and that they're not having to change their lives in order to get to the infusions. The protocols are all very similar in terms of making sure patients receive the care that they need with the appropriate standards in place. So again, recognizing that of course this is going to be a stressful process, but really once you've had the experience of transitioning and having a couple of infusions, so far the feedback from our patients have been very, very positive.
Changing to a biosimilar or changing to a new clinic or even being first time on these types of medications can be scary. And unfortunately, during our current times, we can't have you come in and tour our clinic, but I wanted to give you a little bit of information on what you can expect. So when the first time you come to our infusion clinics, you would be greeted by a nurse who would ask your name and do a screening for you for the COVID-19 to make sure that you're safe to come into our clinics. And we do that for all patients coming into clinic as well as our nurses.
So for patients, they may be transferring to a biosimilar medication and also transferring to a new clinic potentially. So we want to ensure and reassure that patients are aware that the infusion clinics will be set up in a similar manner. We have this similar support as other infusion clinics. We do also try to keep the same nurse with the same patient. So you'll establish a relationship with your nurse. You'll get to know your nurse over the weeks or months that you're on this medication or years. And you will also be able to receive the same sort of process.
We do have some clinics very close to downtown, but our goal here at Innomar is to be within 50 kilometers of 95% of the population in Ontario. So I'm pretty confident we'll have a clinic close to most patients.
48 hours before your appointment, you will receive a reminder call. During this reminder call, we will ask you additional questions for COVID-19 screening. This is in order to keep our staff and our patients safe.
I'm not sure what clinics you are familiar with, but ours have infusion chairs as well as recliner chairs to help make your stay here comfortable. We have over 40 clinics here in the province of Ontario, so the likelihood is it will be fairly close to your home. And if you're a pediatric patient, you have access to the same number of clinics as anyone else. For our pediatric patients as well as our adult patients, we do have private rooms available in most all of our clinics. So if they are available, patients are welcome to choose that room for their procedure that they're coming for that day, usually the infusion.
The clinic we are showing you today is an example of one of our Bayshore clinics here in Oakville. The clinics are all set up in the same fashion, and you will notice that if you are a patient who is transferring to a biosimilar medication and potentially transferring clinics, you're going to notice that a lot of the clinics are the same as what you have experienced before. All of the clinics that we have the same offerings and amenities, such as the quality of the infusion chairs that we use, Wi-Fi, television, and snacks in the clinic.
During these unprecedented times of COVID, we are asking for adult patients that they don't bring any caregivers or partners with them, because we're really trying to respect the 6 feet distance and social distancing requirements that the province has put out. But if it's a pediatric patient, we are allowing one caregiver to join the pediatric patient.
We currently have our ISO 9001-2015 certification, which is all about continuous quality improvement. And we really strive to ensure that your experience, whether it's at a downtown clinic or in a rural clinic in Ontario, that the experience is the same. During your stay with us, should something happen while you're having your infusion, we do have highly trained nurses that have their advanced life support as well as the necessary medications to help with an allergic reaction. In some of our locations, we are partnered in a physician's office, so we do have a physician on site at times, but we always, regardless of what clinic you're in, have a physician or a nurse practitioner on call to help us should you have allergic reaction to the medication which you are receiving today.
If you are a patient who does travel a lot or who needs to relocate for a period of time, we do have the ability to transfer you to another infusion clinic in another city or another province. So if you're going away for school or if you're moving to another location, we are able to offer the same services and the same infusions in other areas and other provinces. All of the nurses in these other areas and clinics are trained on the same medications in the same fashion as your previous nurse and will be able to assess you and ensure that the continuity of medication is maintained.
Your experience and level of care will be the same whether you're on a biologic or a biosimilar. We provide the same level of care to all of our patients. The new infusion clinic, we definitely have a lot of capacity and we're set up to accept new patients at all of our clinics. Our clinic hours are 8 to 8, Monday through Friday, and we also have Saturday appointments available. So if you need evening appointments or weekend appointments, our scheduling team can definitely help you find the appointment that works best for you at the clinic that's closest for you.
If pre-medications are ordered and required by your physician, your nurse will administer these next. Your medication will have arrived to our clinic prior to your infusion and will be in our temperature-controlled fridge. Your nurse will then remove the medication from the fridge and prepare it on the counter for your infusion. Your nurse will administer the medication over the amount of time ordered by the physician. Every patient and every medication is different, so infusion times will vary. Depending on the site, your physician may be on-site or on call for support should it be needed.
Your infusion will take as long as it needs to ensure that you're getting good quality patient care, and it will really be dictated on the physician orders for how long your infusion takes. We also try very hard whenever your physician is needing you to have some blood work done or blood levels done, that we try and draw those with the same needle poke to start your IV. So we really try and reduce how many needle picks you're getting when you come to our NMR clinics. Those test results then land back with your physician whenever the lab gets those test results completed, but we really try and do it as seamless as possible to give you the best experience.
After your first infusion, we highly recommend that you stay for a 1-hour post-observation period. Some medications will have more than one recommended post-observation period. However, there is always a minimum of 1 hour. We do allow patients to decline this post-observation period through signing our waiver. However, this is not something that we would recommend from a safety perspective.
I think one of the most important things is to recognize that your physician team, your nurses, and the new coordinators that you'll be meeting to help you transition to the biosimilar understand that this is a stressful time. It's completely understandable, and the team is definitely here to work with you to answer any questions that you have and that you will have during the transition process. I think from my experience though in BC, I have to say that although initially there was a lot of concerns, rightly so, from our patients, that overall it's gone very well. And I think one of the keys to that is for patients to understand that their concerns will always be heard and that it is a normal process to feel stressed about it.
Patients sometimes fail a biologic and then have to switch to a new medication. The added benefit for these newer clinics of Innomar and Bayshore is that they will infuse all of the biologics. And now, instead of just changing the medication, you don't actually also have to change your clinic and your nurses during this difficult time of switch. Sometimes there's anxiety of patients switching to a perceived biosimilar or a new medication, but I usually reassure my patients that this is something that's been going on for years. And in fact, multiple countries in Europe, we see these patients who go through the biosimilar switch in other provinces have done exceptionally well. Although they go on to a new medication, they do well clinically, and ultimately the experience in these new clinics in the Innomar and Bayshore is the same as in the original clinics.